Dr. Jace Peters here. Just wanted to take a moment and address something that has been coming up a lot in our practice. I'm going to title this video, Disc Bulge is not a death sentence. And what I mean by that is that people often come to us and say, I have a herniated disc, I have a disc bulge in my back. Chiropractors treat disc bulges all the time without knowing it, but even if we know it, there's a lot we can do with it. So there's two situations that happen with a disc bulge. Either one, the disc bulge is unrelated to your low back pain, which we do see a lot. So they have MRI, there's big studies out there, they put thousands of people through an MRI machine, and what they find is that even though these patients don't have any pain, they were recruited with the study that they didn't have any low back pain, they MRI a wide age range of participants, and what they find is that many of them actually have positive findings on imaging. And I know we've kind of talked about this before, but it's worth mentioning again, specifically when it's related to a disc bulge, is that even people in their 20s, so very, very young people, have disc bulges on MRI and they have absolutely no back pain. So the first example would be that disc bulge that we perhaps see on MRI is unrelated to your low back pain. In fact, I have a chart here, we use this for a patient education tool. I understand that it's backwards, but if you look, 77% of people in their 70s actually have disc bulges on MRI, okay? And then it kind of goes down from there. And if you're in your 40s, 50% of people will have disc bulges on MRI, and these are all in asymptomatic populations. So what that means is they don't have any low back pain. So just because you have a disc bulge doesn't mean you have low back pain. Just because you have low back pain doesn't mean you have a disc bulge. So the first scenario is that disc bulge that we perhaps see on MRI is completely unrelated to your pain. The second example is, yes, in fact, that disc bulge is related to your low back pain, and that isn't super uncommon. We see that, especially if you have symptoms below the knee, that kind of cues us in that that disc bulge is irritating a nerve root, the nerve in your back, and causing symptoms in your leg. The good thing is that 63% of disc bulges are going to reabsorb on their own, meaning even if you didn't do anything, that tissue is going to heal. And that's something important to think about, is that just like any other tissue in the body, let's say we have a paper cut on our finger, that will heal regardless of what you do for it. We can do things for it to create an environment that healing is going to be progressed, and that's what I like to think about what that chiropractic can do. So if you have a disc bulge, we can find different ways, whether it's mechanically, chemically, if we need to get medication, to kind of create an environment that disc bulge can heal. So 63% of disc bulges are going to reabsorb, meaning they're actually going to heal and get smaller with time. Also of note, the size of the disc bulge that they see on MRI is completely unrelated to the pain. It does not correlate. We don't see bigger bulges don't cause more pain and smaller bulges don't cause less pain. So that's something to think about. Every time, we have patients that come in here and be like, I had this huge disc bulge at L5-S1. It's like, okay, it's good to know. Are you having any radicular symptoms, any symptoms in the leg? And if not, we evaluate them the same way as we do everybody else, and that's through a proper assessment that's going to kind of dictate our treatment. So that doesn't change. I just wanted my word of advice: if you have gotten an MRI, I would definitely say start with chiropractic or conservative care first. Oftentimes an MRI wouldn't even be indicated. So if you're having some low back pain, get it evaluated. It's important that you actually try conservative care before you go down that MRI imaging, because they've also done studies that if you get early imaging and we see the disc bulge on MRI, it's going to probably cost you more money to treat that, as opposed to if you started out with something a little bit more conservative like chiropractic and physical therapy. So if you have any questions, I'd be happy to help you out. We see disc bulges all the time, really confident in treating them. 402-933-4447. Thanks.